told you there's a way to turn back the hands of time without surgery. Well, Dr. Annabelle Garcia is a board-certified dermatologist from Sonterra Dermatology, and she's here to tell us how it can be done. Good morning, doctor.
Good morning.
Good to have you here.
Thank you.
We're always wondering how it can be done. So what are some of the ways it can be done?
Well, you know, we use cosmetic fillers a lot as a cosmetic procedure. Cosmetic fillers are injected into the skin in order to soften the lines of the face that appear due to the aging process. So a very common procedure.
Yes, when we get to a certain age, we do not want to see some of those lines. We want to get rid of them or at least prevent them, correct?
Correct. You know, the hallmark of the aging face is loss of volume. So these fillers act as volumizers to kind of reverse that a little bit.
So that's what a filler does.
Correct.
It volumizes.
It volumizes areas around the face, such, you know, we call them the parentheses or the nasolabial folds, the folds that go from the base of our nose to the corners of our mouth. What we call the marionette lines, which are the lines that go from the corners of our mouth down to the chin area. And even the tear troughs, which are the area under the eyelids.
Okay, so what is this right here? We see
so
before
this
and
woman
after.
has had Juvederm Ultra Plus injected into her parentheses or nasolabial folds. So you see that the lines around her mouth are very much softened. So it gives her a more refreshed and youthful appearance.
Oh my goodness, what a huge difference there, right?
Yes.
I mean, because you see a little bit of contouring, and the contouring you don't want.
Absolutely. We're trying to reverse that a bit. So this lady's also had similar procedure. Juvederm Ultra Plus injected into her nasal labials and marionette lines in the corners of her mouth.
You know, when I read marionette lines, I was thinking of a puppet, but I see now it's the around the mouth,
Right.
it's the shape of the puppet's mouth, correct?
Correct.
Okay.
Correct.
And now there's something else that I want to mention, and that is tear troughs, I think, was another one too.
Tear
right?
troughs. So tear troughs are, you know, people always say, oh, I hate the dark circles under my eyes. I have bags. I have really sunken areas. So that's an off-label indication of fillers, but we still
Right
do
now,
that, and it's
Verizon
a
is
safe
offering a
procedure
limit-
with minimal downtime.
I see. And this video right here, what are we looking at?
So we're injecting her nasolabial folds, and there we're actually injecting her tear troughs. So we're just placing the filler right there in that indention under her eyelids.
Okay, she's smiling, so she's doing okay.
Yes, yes. We use topical numbing to maximize comfort during those procedures. I have patients who do this over their lunch break. So
Over
it's
their lunch break?
minimal downtime with just minimal side effects.
And that's why we say no surgery. Because when we think about turning back the hands of time, we think of, oh gosh, I'm going to be under the knife for a while. No.
Right. So these are alternatives to patients who aren't ready to take that big step and be under general anesthesia.
Yes, and I want to mention this too because you've got a great offer for our viewers, and that is you can get 15% off. Is that right?
Correct. If they mention Great Day SA.
All right, so you get 15% off when you book an appointment with Dr. Garcia at Sonterra Dermatology. Just mention Great Day SA. Go see them. You can transform not just your body, but also your face. So give them a call at this number. It is 960-8186. 8986, pardon me, 960-8986, and log on to their website, sonterradermatology.com. You want to get rid of those lines right here. I'm telling you, every time I wake up in the morning, I say, ooh, get rid of those tear troughs. Right here, okay. Thank you so much, doctor.
Thank you.
All right.
For 9 years, I've had melasma from my pregnancies on different parts of my face. But I'm going to show you after I take off about 5 layers of makeup here. If I go out in the sun, I get black spots here. My entire cheek turns black. I keep a 50 sunscreen in my car. So I've been dealing with a lot of different issues as well, trying to figure out how do I cover this up.
Well, you recognize that face. That was actress and TV spokesmodel Brooke Burke sharing what can be an embarrassing skin condition for a lot of people. How much do you know about it, and what are your risks for getting it? Well, this morning we've invited Dr. Annabelle Garcia here. She's a certified dermatologist who knows a lot about this particular thing. Thank you, Dr. Garcia, for being here.
Thank you for having me.
I gotta be honest, I didn't know a lot about it until I heard Brooke's story. What is melasma, and who's at risk for it?
Well, you know, melasma is a very common condition, especially in pregnant women. So it consists of brown, patchy spots, usually on the mid-central face, mid-forehead, and upper lip. Those are the most common sites.
Now, is there really a way to prevent it, or is this just something you're likely to develop if you're just, you know, at risk for getting it?
So prevention is primarily focused on sun protection. I know I say that a lot, but sun protection is the most important. There are other prescription grade fading creams that can really help, but sun protection is the most important factor.
And because you are a certified dermatologist and you see all kinds of skin, it's a perfect question to ask you, how much SPF should we be getting on a daily basis, be it summer, winter, regardless?
Right. I tell my patients to focus on an SPF of 30 at